Ochiltree General did save my life. 10 years ago, had my first heart attack. Went out to Ochiltree General and they took care of me really quickly, got everything diagnosed. A few months ago, about 4 months ago, I had another heart attack. They rushed me in, saved my life, got me stabilized. Several of my friends, as we aged, would probably not still be around if it weren't for Ochiltree General Hospital. Having that local ability to save your life is critical. And the hospital has certainly served us well through the years, but it's time to upgrade and make sure that it's going to take care of not only us over the next several years, but our children in the future.
The future of medicine and the way things are changing is happening very rapidly. And planning for the future is so important. Because of those changes, we need to be thinking forward as to what our needs will be. We need to be looking at our community to see what type of patients we have here in Perryton.
I've been a nurse for well over 50 years, and medicine has certainly changed a lot. We see more outpatient care now than we did.
You have to continually look ahead. You have to have a vision. You know, you think 5 years, boy, that's quite a ways out to be thinking. But when you start talking 10, 15, 20, what's going to happen in 50, it's hard to do that. But that's kind of the step we're taking right now, is trying to plan for the next 50.
We do need to make changes and additions to the hospital to be ready for this change in the way medical care is delivered. And I'm excited about the plans that we have. It's to add ancillary services, we'll add an OR, and we'll add a clinic. We will have the capability to deliver medicine on an outpatient basis more thoroughly, more often, and that's where medicine's headed. Even surgeries are done on an outpatient basis now that never used to be.
If Dr. Blasingame is going to come back and be a surgeon here, we have to provide facilities for him that are current for, if anything. We don't have that right now. The idea of a clinic where you have the doctors all together, you have expanded operating facilities, you have an expanded lab, it's all things that are vital to this hospital. You know, back when my dad practiced, he had his own lab, he had his own x-ray machine. Those days are gone.
It is important for us to grow and expand when it comes to all the ancillary care, and as well as the surgical center that we're looking into getting back, because it helps us be able to bring those resources to our community and kind of keep everything in our community where our patients are being taken care of by their home care providers, everybody that is knowing them and that takes care of them, and we can follow up and follow through with that in our own hometown.
Helicopters can only get here so fast, so we need to be prepared for any type of emergency, whether it's during a delivery, whether it's right after a birth, whether it's a car accident, something happened at a football game. We've got to be able to take care of that patient immediately, stabilize them to get them to where they're needed.
I think for Perryton it's very important, because we are so far away from tertiary care, that we need to do everything we can to improve or expand our services as much as possible. In order for us to survive, we have to be able to change and morph into what those needs are for the community, as well as being responsible from a financial standpoint.
It has to grow and expand, just like the community has to grow and expand, and to give medical services and also the newer medical services that are coming down the pike.
With the new doctors coming in like we have coming in and stuff, it's crucial. All the expansions they're going to make and all the things they're going to add to it's really going to be wonderful. It's really going to be a great deal.
From an economic standpoint for that community, it is so important to have institutions such as a hospital available in that community.
The hospital has over 100 employees and a great big payroll, and this new addition is going to add 20 or 30 more employees to the community. So it's going to be an important impact.
if we're going to continue to provide the services and provide it locally, we've got to update, we've got to continually stay on the edge, I think, to keep the revenue flowing.
We are trying to combat this problem that we're seeing where rural hospitals are being closed. We're trying to offer more services. We're trying to expand our laboratory, radiology, obstetrical services, surgical services, anesthesia coverage so that we can keep people here in this community.
We want to be able to provide you better care and more revolutionary care that other hospitals in bigger cities have been bringing to us, and we can all do that from our hometown, from our home.
Where would we be if our forefathers didn't take that call to action? If they didn't vote to build a hospital or vote to improve the hospital years ago, where would we be now? We would be like a lot of these towns that are even bigger than us, that are basically out of health care and don't have the ability to take care of their clients and their people in their community.
That's one of the great things about living in Perryton is that we take care of each other, and we should all take ownership in doing everything we can to try and help provide the services that the hospital district can provide, that the city can provide, that the school district can provide, but that comes from us, and every one of us can be a part of that.
I have always been impressed by the way this community rallies behind its causes. Our community in many different events, charitable organizations, have always had such luck because the people in this community really support it. It's going to take a little bit from everyone, and I know this community will come through.
We're so fortunate to have a facility that we have for the size of our community, and there's not another community that has a hospital as good as we have that's small. So I would encourage everybody to give and support the hospital.
This community has always been good about rallying behind certain venues like this, and I don't think they'll be short on this either. I think the city of Perryton will really get behind this and really help.
I just am proud to be a part of this, and I think that it's something that is going to make a big impact on Perryton's future. I really do, and I think it will keep medical care at home in Perryton. It will be a really nice thing to be able to take care of several generations to come with these new facilities that we'll be adding.
Well, Perryton has been wonderful to me, to our family, to my husband. We've had a wonderful life here, and I'm anxious to participate in this program and give back to Perryton some of what Perryton has given to us.